Good afternoon, everyone. Thank you so much for taking time out of your day to hear more about the recently released version 2 of FEMA's interim policy regarding safe opening and operations, work eligible for public assistance. Please note this policy applies to DR 4480, aka COVID-19, the major disaster declaration for New York State in response to COVID-19 pandemic. My name is Rihanna Gonzalez, and I am the Deputy Director of Recovery Programs with the New York State Division of Homeland Security and Emergency Services. I'd like to extend a warm thanks to Molly Avancho, who continues to provide clarity and support to New York State as we all navigate the use of PA for the COVID-19 disaster. I really appreciate your partnership, Molly. You've always been there to help us as we navigate the changing waters of COVID-19. So for those of you on the phone, please know that the presentation will be posted on the DSH's website along with other materials associated with 4480, as well as the FEMA policy and any other useful information. We will also post this recording, and then we will also include the question and answers that we covered today on there. So we urge you, as we continue with this open declaration for COVID-19, to visit the website frequently. As policies change and analysis and clarity is provided, we put the information online. So with that, we'll get started. If you can hold on for 1 second, we're having a bit of a technical difficulty. Apologies for those technical difficulties. We are working remotely from the World Trade Center in our JFO, so apologies. So as I was saying, we are here to talk about, with our partners at FEMA, Molly Avancho, the revised interim policy for safe opening and operations eligible work for public assistance. In April of 2021, FEMA released its original interim policy on the safe opening and operation, work policy eligible for public assistance, which recognized President Biden's memorandum to extend federal support to governors' use of the National Guard to respond to COVID-19 and to increase reimbursement and other assistance provided to the states that was issued on April 5th of 2021. That presidential memo authorized FEMA to provide funding to public assistance applicants for the safe opening and operation of eligible facilities at 100% federal cost share, but limited its application to eligible work performed from January 21st of 2021 through September 30th of 2021. Version 2 of the interim policy that was issued September 9th of 2021 extends the period at which reimbursement at 100% federal cost share is available. Specifically, the revised interim policy recognizes President Biden's August 17, 2021 memorandum on maximizing assistance to respond to COVID-19, which authorized 100% federal cost share for all eligible Category B work performed from January 20th of 2020 through December 21st of 2021. Eligible work performed after December 31st, 2021 will be reimbursed subject to the federal cost share established at that time. So the key change in this policy is that the 100% federal cost share for eligible Category B work was extended to retro to January 20th of 2021 and through December 21st of 2021. At this time, there is no end date of the period of performance. FEMA will let us know when its deadline is established. We ask that you continue to check DSH's website for 4480, as we will continue to have and post any changes there. The definition of eligible work for COVID-19 declarations has evolved substantially over the last 18 months since the incident period began. FEMA issued several policies or fact sheets addressing a variety of topics, including, but not limited to, medical care, alternate care sites, food purchasing and distribution, and non-congregate sheltering. In September of 2020, FEMA issued its internal policy titled Coronavirus Pandemic Work Eligible for Public Assistance, which referenced those earlier policies and clarified eligible work, in some cases restricting eligibility on work that was previously deemed eligible. At this time, any work that is eligible under the September interim policy remains eligible for public assistance. However, some restrictions that were placed on eligibility by the September interim policy are modified by this interim policy for safe opening and operations. Consequently, if you perform work that is not eligible under the September 2020 interim policy, you should turn to the revised interim policy for safe opening and operations to see if it is now eligible. Specifically, refer to Section C4 of the revised interim policy for safe opening and operations, and we'll discuss more on the next slide. Section C4 of the revised interim safe opening and operations policy authorizes reimbursement from the beginning of the incident period for PPE and face mask, cleaning and disinfection costs beyond the applicant's regularly budgeted cost, COVID-19 diagnostic testing, screening and temperature scanning cost, temporary physical barriers or dividers and signage to support social distancing. Purchase and storage of PPE and other supplies should be based on projected needs for the safe opening and operation of the facility. Some eligibility considerations. In order for work related to the safe opening and operation and COVID-19 pandemic, the item of work must continue to be the legal responsibility of the eligible applicant. All work must be required as a direct result of the pandemic. The applicant must abide by the equitable response and recovery requirements outlined in the policy. This applies to work performed from January 20th of 2020 and ongoing until FEMA establishes a deadline for the eligible work. The applicant must also demonstrate that it has a legal responsibility to perform the work. Generally, protecting public health and safety is deemed the legal responsibility of the state, local, tribal, and territorial government entities. To determine legal responsibility for emergency work, FEMA evaluates whether the applicant requesting the assistance either had jurisdiction over the area or legal authority to conduct the work related to the request at the time of the incident. The legally responsible government can enter into formal agreements or contracts when it is necessary to carry out eligible emergency protective measures in response to the pandemic. FEMA has waived the primary use and primary ownership normally applicable to PNPs that own or operate mixed-use facilities. As stated in previous COVID-specific policy presentations and prior application briefings, costs must be necessary and reasonable to respond to the COVID-19 pandemic. They must conform to standard PA program eligibility and other federal requirements. Applicants follow its established policies and procedures that apply when federal funding is not available. Cost is documented with sufficient detail for FEMA to evaluate compliance with federal laws, rules, other PA program requirements. In regards to equitable pandemic response and recovery, as we all know, the executive order that was issued on January 21st of 2021 to ensure an equitable pandemic response and recovery in response to COVID-19 having a disproportionate impact on communities of color and other underserved populations, including members of the LGBTQIA+ communities, persons with disabilities, those with limited English proficiency, and those living at the margins of our economy. As a condition of receiving PA funding, recipients and subrecipients must focus the use of FEMA funding on the highest risk communities and underserved populations. Recipients and subrecipients must prioritize resources to ensure an equitable pandemic response. Failure to adhere to this policy could result in funding reductions and/or delays. FEMA will be monitoring the compliance. No person on the grounds of race, color, or national origin should be excluded from participation in, be denied the benefits of, or be otherwise subject to discrimination under any program or activity receiving financial assistance from FEMA. The distribution of disaster relief must be accomplished in an equitable and impartial manner. Now to talk about the coordination of funding. FEMA may provide public assistance funding to applicants for work eligible under DR 4480 that may also be eligible for funding under another federal agency's authorities. Potential PA applicants may have the flexibility to determine which source of funding to use for their cost. If an eligible applicant applies for PA funding and then determines it will instead seek funding from another federal agency, the applicant should notify FEMA as soon as possible and no later than 30 days from the date the decision to seek funding from another federal agency is made. PA funding should not be considered the funding of last resort. PA funding should be considered concurrently with other federal agency programs and sources. For certain types of work that may be eligible for funding another agency's authorities, FEMA, in coordination with other federal agencies, has determined that it will not provide reimbursement for such work through the Public Assistance Program. FEMA has determined that PA is not the appropriate source of funding for COVID-19 contact tracing, as there are more appropriate sources of funding. This is consistent to prior policy guidance. Please see FEMA's fact sheet on coordinating public assistance and other sources of federal funding at the link on this slide, which will be posted after this presentation. That concludes our presentation regarding version 2 of the opening and operating policy. We are now going to open it up for questions for FEMA Region 2 for Molly. I do have some questions coming in. Molly, I can read those, and then we can go from there if that works.
Sounds good.
Okay. So first question I have is, does version 2 of the safe opening and operation policy withdraw or cancel the previous versions?
Yes, it essentially supersedes the previous version. It doesn't change any of the eligibility criteria that was established in the first version. It simply extends eligibility back towards the start of the the incident period, and also extends the 100% cost share till the end of the year.
Thank you, Molly. Does version 2 of the safe opening and operation policy change the eligibility of any cost that was deemed ineligible by the previous versions?
Yes, it certainly does. There were, costs that were denied in some cases for work completed prior to September, or I guess January 20th. 21st, when the first policy went into effect. So any funding that was denied prior to version 2 coming out, which extended, basically is retroactively applying the eligibility period of eligibility of this work back to the start of the incident period. So with that retroactive application, there very well could have been costs denied that are now actually eligible. If I understood that question correctly.
Yes, thank you, Molly. Are there still 3 time periods with distinct criteria for eligible work? Or is there now only 1 time period, January 20th of 2020 through December 31st of 2021? Or are there now 4 different time periods?
The way I look at it, there are still 2 time periods. I think before we were looking at 3. With this retroactive application, it's brought it down to 2. And that's because there is some work that may be eligible if performed prior to September 15th of 2020. The policy that came out on September 1st of 2020, it restricted eligibility to for work completed after September 15th. So there is the period of from the incident period to September 15th where we don't have the same restrictions or some of the same restrictions that are in place for work performed after September 15th.
Thank you, Molly. So if I'm understanding you correctly, from January 20th of 2020 through September 15th of 2020, that would be 1 time period. And then starting September 15th of 2020 through December 31st of 2021 would be a 2nd time period due to what is eligible for reimbursement.
Right, and that's only for what's determined, the limit in eligibility established under that September 1 policy. There is only 1 time period now for opening and operating, though. There's that starts from the incident period and is open-ended at this period of time.
And then another question is, what is the federal share for the new policy? I believe that continues to be 100% under this new policy. Is that correct,
Yes.
Molly?
Yes, through the end of 2021.
Excellent. And then a bit of a repeat. The eligibility period for all safe reopening and operation work described in version 2 is now the beginning of the incident period through December 31st of 2021. And I believe you had already stated that that's the case.
Right. Well, it's actually the start of the incident period, but it has no end period right now. It's open-ended.
Okay, thank you. Another question that came in, some activities such as communications of general health and safety information to the public were included in the original fact sheet issued March 19th of 2020, and the interim policy has an eligible activity, but communications of general health and safety are not specifically listed. Are these activities continue to be eligible after September 15th of 2020?
I believe those are covered under the the policy that came out on September 1st. I'm not looking at that policy, honestly. I just have the, sorry, I'm just looking at the opening and operating policy. But I'm pretty sure communications is addressed in the September 1 policy, which establishes that it's eligible. So it remains eligible. I'm trying to pull up that policy while we speak, but so once I pull it up, I will be able to answer.
Thank you, Molly. And while we wait for that, another question came in. Would this policy apply to technology purchased in order to provide remote services for outpatient clinics?
For outpatient clinics, that's kind of difficult to answer because I'm not exactly sure what work we're talking about. It's not eligible That type of thing is not eligible under the opening and operating policy, but depending on the specifics, if it's related to medical care, it might be, costs associated with telehealth and technology associated with the purchase of technology associated with telehealth services are not eligible. So that's kind of the general answer is no, that would not be eligible. But if it was necessary to set up a temporary medical facility, then it could be eligible. So again, it's a hard question to answer without all the details.
Understood. So for the individual who wrote that question in the chat box, I would recommend if you are already an applicant to reach out to your DAR, and then we can follow up with more specifics. So I have another question, Molly. If a school sat students at long tables pre-COVID, and now the tables won't accommodate the students sitting 6 feet apart, would the purchase of individual desks be an eligible expense under this policy?
No, unfortunately, that is not covered in the opening and operating policy. So no, it would not be eligible.
Thank you, Molly. Another question. My agency did not previously qualify as eligible work for these FEMA funds, only submitting CARES. As such, we have not been involved in past FEMA presentation or resources. Oh, this is probably a question for me, Molly, sorry. Where might I find more information on the qualification changes to review and reconform its applicability to us? So the individual who sent that in, if you were not eligible before and you're just trying to catch up given the evolution of policy associated with COVID-19, 4480, public assistance reimbursement, I highly recommend you go to our website. We have downloaded previous presentations, and we will be downloading the slides for this presentation, so that way you have access to that information. And as always, you will notice on our website at DISHES that there is a generic email address that you can email, and then we can have a staff person get back to you regarding your specific situation. So sorry for that commercial interruption, Molly.
No problem. And to get back to that other question, I did open up the September 1 policy, and communications to disseminate public information regarding health and safety measures and provide warnings about risks and hazards is listed in that policy. So it is, the eligibility for that type of work has not changed.
Great, thank you. So question about contact tracing. The applicant is asking, what about cost of contact tracing that was done prior to September 20th of 2020? Would those costs be eligible with public assistance funding?
No, not under public assistance.
So regardless of, just so I can make sure I understand, Molly, regardless of the time period in which expenditures for contact tracing were incurred, it is not eligible for public assistance reimbursement, yes. Period.
Yeah, okay. Yes.
Just want to make sure folks understand it's not that it's the time frame, it's just not an eligible cost. Okay, so another question in regards to appeals. How will FEMA address those previous denials of work that are now eligible if they are past their appeal window?
If you're past your appeal window and you had a determination memo issued already, the operational staff are going through all of the determination memos that have been issued and looking for those memos that, you know, where we denied funding that we can now fund. And the operational staff should be reaching out to you to see if you still want to pursue funding under public assistance for that work. Because some applicants may have just gone and used CARES Act funding, for example, and so maybe they no longer want the funding through public assistance. But if you do, then in most cases, those determination memos will be rescinded and the projects will be processed. There may be some situations where, based on the information that we have on file, we may not be able to approve funding without additional information first, but there's no penalty, I guess I should say, for having not submitted an appeal.
Let me make sure I understand that. What you're saying is that you have administrative staff going through prior projects to see if things may have been denied, regardless of if the applicant appealed, and then you will be someone will be in contact with those applicants due to the rule change?
Yes, that's the way in general things are being handled. I'm not sure specifically how the operational folks, it may be slightly different in New York State, as far as how the outreach to applicants is. So you'll really need to, speak with the, operational folks on the specifics there. But basically the short answer is, if you did not appeal a determination, you are still going to be eligible to receive that funding, even if you didn't submit an appeal. So if no one reaches out to you, and then you should certainly reach out to, your state, the folks you work with in the state, because they can help you navigate the process with Fema to get that funding.
Yes, definitely. Thank you, Molly.
Mm-hmm.
Has there been an official decision that CRCs are not to submit RFIs to applicants when there's a question or concern about eligibility, instead of requesting clarity regarding the items to go directly to a decision memo?
Well, it depends, because for the most part, what CRCs can do is submit requests for information to an applicant for documentation that may be missing. And the reason they, would be asking for documentation is to support eligibility. So it's all tied to eligibility. It's just that, there may be something that the CRC expects to see in the record, some documentation that's not there. And so they may submit a request for information to get that documentation.
Understood. Going back to appeals for a minute, if there were items that were denied but now appear to be eligible, what do we do if the application was sent? Do we need to go back and resubmit, or would you look at denied items and reimburse accordingly? And if I understood you correctly, Molly, your operations staff are going through any claims or damages that were denied, but should an applicant not hear back in a set amount of time, perhaps they should resubmit, or did I misinterpret you earlier?
Yeah, it's really hard for me to answer, since I don't know exactly what they're doing in the operation.
Okay.
All I can say is that the intent is that FEMA take the burden off of the applicants, and FEMA identify where we've denied funding, where that funding is now eligible, and that FEMA reach out to the applicants to engage to see whether they still want the funding, and then we can simply rescind the determination memo and proceed with the project. I can't swear that that's the way it's happening, because I'm not operational. So my advice to applicants is that they can, if they're working directly with someone, if you have a program delivery manager with FEMA, you can reach out to that individual, or if you have a state person that you work with, you can reach out to that individual and get your question answered on how that's going to work.
Thank you, Molly. Employers following the governor's mandate of non-vaccinated employees needing to fulfill vacant positions with temporary or backfilling vaccinated employees, are these eligible costs? I'm not quite sure I understand that. What I think they're asking is if there's a governor's mandate to have employees vaccinated.
Sorry, difficult to answer those kind of questions. The way public assistance works is we have to look at the actual work that's being performed by an employee.
I think we lost you, Molly.
Hello?
Hi, Molly. You're back.
I'm not sure if you can hear me. I can't hear you very well.
Can you hear me now?
You're just breaking up.
How about now? You're clear. You can go ahead.
Okay, I think you just said that I'm clear. So hopefully you heard my response there, but you're still breaking up a bit, at least to me. Okay, can I repeat? Okay, so what I was saying was that it's very difficult to tell you what labor costs may be eligible without knowing specifically what the work is being done by those individuals, because that's the way public assistance funding works. It's that we have to look at the work that's being performed. And if that work is eligible under public assistance, then we can look at labor costs associated with that work.
Thank you, Molly. Can you hear me better now?
Oh, you are breaking up a lot.
Hi, Molly. Is that any better? Hello? Hello? Hey, Molly, it seems that other folks can hear me, but unfortunately you can't, so I'm going to try to text you the question.
Okay, I can hear you. I actually just totally understood what you said. It's just you're just garbled a little bit on my end. So we can try that.
For that. So the next question is, if a hospital tests everyone entering the hospital for COVID-19, does version 2 of the policy read that that diagnostic testing is eligible?
Yeah, sorry, I can't hear you. Sorry, that didn't come through at all. I'm trying to figure out, are you reading from the Q&A? If I can figure out where you are in the Q&A, maybe I can just read from that directly. Okay, is the hospital that tests everyone for COVID-19 considered diagnostic and reimbursable? Again, some of these questions, it's going to be hard to answer without Specifics, again, hard. I don't think I can answer that question. I think if you're going to have those kind of really specific questions, you're going to want to work with your FEMA PDMG so that they can get your program delivery manager so that they can get all of the details of your specific project and that they can tell you what's eligible. In general, diagnostic testing is eligible for both operating under the opening and operating policy and under the medical care policy. But it just depends on, a few things. Things have to be necessary and reasonable. So, potentially if I don't know, if there was a entity that was testing everyone on the hour, maybe FEMA would say, oh, that doesn't really seem reasonable. We wouldn't fund that. I mean, that's kind of a exaggerated example, but that's why it's hard for me to answer these specific questions. So you'll want to take that to the folks that you're working with at FEMA. Okay, once an application has reached final review at New York State, how long does it take for a large project to be approved for drawdown? Another question that I can't answer. That's an operational question. COVID testing kits for testing unvaccinated worksite employees eligible. Testing, COVID diagnostic testing that's necessary to safely operate a facility is eligible. So if an applicant is operating a facility and they have unvaccinated workers that they want to test, absolutely it's eligible. Of course, subject to all of our other eligibility criteria, that it has to be reasonable. What activities, if any, will be evaluated on a case-by-case basis? Really, everything we do is evaluated on a case-by-case basis because we're subject to eligibility criteria like, things have to be necessary and reasonable. So, what I can do is tell you what the policy says in general is eligible, but there may be a situation where, depending on what's the actual funding that's being requested or the actual activity that's being performed, there may be some eligibility issues that I wouldn't be able to, I wouldn't know about without getting into the nitty-gritty. iPads and tablets for remote learning in education. That is not an eligible expense under the opening and operating policy. So no, not eligible. And the question is in terms of nonprofit schools, but the answer would be the same for public schools. It's just not something that FEMA is funding. Okay, next question. Is force account non-overtime labor an eligible claim expense for the building and installation of protective barriers? No. For emergency work, FEMA can only fund overtime for an applicant's employees. Okay, the next question is about the costs of purchasing computers so staff could work remotely, and will FEMA cover the cost of computers? And the answer is no, that is not something that FEMA is covering. With respect to air filters, the question is, do MERV air filters still have to be MERV 13 or higher to qualify for reimbursement? The opening and operating policy that came out does not include ventilation or air filters in its list of eligible eligible work or expenses. So at least under the operating and the opening and operating policy, cost for air filters is not eligible. So there may be a situation in a healthcare setting that it's necessary for some other reason. I can't really think of a reason right now. I just don't want to say, no, we're not funding any air filters, because there may be some situation out there that I can't think of right now. But in general, under the opening and operating policy, the cost of air filters is not eligible.
Can you hear me now, Molly?
I can.
If a university has been conducting surveillance testing of students, faculty, and staff while continuing in-person operations, would those costs be eligible?
Yes, they certainly could be eligible if all of our other eligibility criteria has been met, as far as reasonableness and necessary, that sort of thing.
Thank you. We have monthly in-person meetings that had to be held remotely. We had to use a court reporter to take verbatim notes. Are the costs of the court reporter eligible for reimbursement?
No, not under public assistance, no.
Thank you, Molly. And going back to the hospital, this may be a slight repeat, but just because I know it's important to folks. If a hospital tests everyone entering the hospital for COVID-19 under the new policy, could that be deemed diagnostic in order to minimize impacts of the coronavirus on those in the hospital?
It could. Again, if there are those kind of very specific questions, I'm not going to say yes or no, but according to the policy that sounds to me that it's necessary to do that to safely operate the hospital. And that's certainly something we can cover under public assistance, but there may be some specifics that I'm not aware of that would limit eligibility.
Thank you, Molly. Someone asked if K through 12 schools are eligible. Molly, please fill in the blanks, but essentially if you are a not-for-profit school and you have eligible costs associated with the opening and operation of your respective school, and it's not an increased operating cost, but a direct result of COVID-19, those costs could possibly be reimbursable under public assistance.
Yes, for the work that's listed in the opening and operating policy. Yes.
Excellent, thank you. Another question, are air purification systems in public spaces, such as town halls, eligible for reimbursement in order to have safe public meetings?
Not under our current policy, no.
Thank you. Someone asked, are previously established essential P&Ps still included? I'm guessing they're asking if they would still be an applicant. So provided that you are providing a response to COVID-19, the material that we covered earlier, there is potential for you to be eligible. Next question, Molly. Page 57 of the Papa G provides a more broad approach to COVID-19, including supplies and commodities, mass mortuary services, etc. This policy covers all PPE, face mask, signs, supplies, etc. How is Fema legally allowed to narrow eligibility retroactively?
I can't say that we are narrowing eligibility retroactively. So I that's not a question that I'm going to
Yeah.
answer.
No, so for the individual who wrote that, I think maybe if you could take a quick read through the version 2 policy. If anything, it tries to provide more clarity than the Papa G. And then if you already have a DAR assigned to you, touch base with them so we can get your more specific question answered. Okay, with that, Molly, our costs to perform temperature checks now reimbursable from the beginning of the pandemic, January 20th of 2020 through December 31st of 2021, regardless of locations.
Well, I mean, regardless of location, I mean, you can't, we're not going to fund somebody standing out on the street testing people's temperature. It has to do with whether it's associated with the safe opening and operating of an eligible facility. So if you're talking about at a facility, yes, be eligible back to incident period.
Thank you, Molly. Going back to PPE, does version 2?
And I'm sorry if I'm saying things that are kind of silly, but I'll tell you what, I'll make a comment and say yes on a call like this, and then, you know, someone will say, well, Molly Boncho said that they pay for temperature screening on the street corner. So I'm sorry if some of my qualifications to my answers, they may sound a little obnoxious, and I apologize for that.
No, I appreciate that qualification. We just want to know the rules in New York State, so thank you for that. Does version 2 of the policy include covering the cost of shipping, storing, and receiving large amounts of PPE? With limited space in New York City, we had to seek additional warehouse space.
Yes, we have. There's a couple of different parts of our policy that would cover something like that. You know, we fund for example, for opening and operating, we will pay for costs associated with the purchase of, you know, what's reasonably justified and needed. And if in turn that requires, you know, costs of storage, then we could fund that. There's another situation where if you're stockpiling for future use, and you can support that you need it for, you know, a certain period of time, I think it was 60 days under the September 1 policy, we can fund that potentially as well. So I just, there are some, you know, possibilities there. I just suggest that you work with your FEMA program delivery manager to get the specifics on that.
Thank you, Molly. Another applicant is asking, is there guidance on how far in the future projected PPE quantities should be estimated to make purchases now to last for an appropriate amount of time?
Again, I'm scrolling through the September 1 policy. I believe, again, I'm sorry, I was only thinking we were talking about operating and opening and operating, but I'm pretty sure the September 1 policy includes a time frame. Best, because I don't want to, best to just talk to your program delivery manager about that. Because I can't find it at the moment.
I understand. Thank you, Molly. We'll get back to that applicant.
Okay.
For a hospital in a rent, if the rental is still on, okay, sorry, I didn't understand that question. I apologize. Are costs incurred after 9/14/2020 regarding overtime, AKA forced account labor, and temp agencies eligible for reimbursement, provided these costs are COVID related?
It all depends on the work that's being performed by the individual. So I couldn't answer that question unless I know what work is being performed. Again, work with your program delivery manager on that.
Thank you, Molly. How do community centers who have provided care for elderly in the community during COVID prove they're legally obligated to do so?
How do I'm sorry?
How do community centers who have provided care for the elderly in the community during COVID prove that they are legally obligated to do so?
Okay, that's another difficult question to answer. If it would be on that community center to be able to prove that. In general, FEMA looks at the legal responsible entity to provide emergency support to citizens is the government, the local government, state government. There are private nonprofit organizations that do provide support to the community, but they're not legally obligated to do it. It's their mission, but it's not their legal responsibility to perform that type of work. So generally FEMA will not, FEMA will say that the private nonprofit doesn't have the legal authority to do that. And, but if the private nonprofit can prove otherwise, I don't know how they could. And I think that's what the question is, that would be on the private nonprofit to be able to do that.
Thank you, Molly. Another question, is upgrading HVAC system for safe opening an eligible work and cost?
No, it's not.
So I just want to make sure I understand, the simple purchase of the HVAC is not eligible if it's done for school in order to...
Yes, it's not listed, sorry. The HVAC, filtration, ventilation, air filtration, none of that is included in the operating and opening policy. So it is not eligible for reimbursement.
Thank you. A school that did COVID testing, would the security overtime hours for the COVID screening be considered eligible?
If security is necessary, then to do the work, then yes.
Thank you. If a school has been renting and continues to rent 40-foot containers to store unused furniture in order to permit social distancing required by the state in schools, would the rental of those containers be eligible?
No, not under public assistance.
Thank you, Molly. This isn't for you, but I just want to make sure that we're responding to our applicants. Somebody's asking where they can get help requesting funding applications as well as videos to apply. Please go to the DISH's website, and on there is information on how to apply for public assistance, reimbursement, as well as where to get help, one-on-one technical assistance if needed. So another question, Molly. An employee of ours was designated a COVID coordinator last school year for the purpose of contract tracing and testing coordination. Would the hours she spent on these tasks out of her 8-hour day be eligible for reimbursement?
No, not under public assistance, no.
Thank you. So next question, Molly. What kind of facility costs, other than cleaning and disinfecting, are eligible? For example, upgrading the HVAC system, portable air purifiers, and/or UV lighting. Would those items be eligible under this opening policy?
No, it's only what's listed in the policy.
Thank you.
Mhm.
With testing being eligible, will staff who assist with testing be considered eligible if they're doing the scheduling for the testing?
It all depends on what type of staff it is, whether they're full-time, part-time, temporary, whether they're working regular time or overtime. So you'd have to provide the specifics to your operational folks, the program delivery manager, perhaps, to get an answer to that.
Thank you. Next question. If CARES Act money was applied to certain costs by an institution because costs such as diagnostic testing were originally ineligible for reimbursement, is there any way to recoup public assistance money and reallocate CARES money to other CARES eligible items?
My issue with that, answering that question, is I don't know what the rules are as far as reallocating funding that you receive through CARES Act. So if CARES Act allows for that and you reallocate that funding to something else that wouldn't be eligible under public assistance, then yes, you could then come and get public assistance reimbursement for it.
Thank you. Another question. If our city sent an RFP to provide food for seniors during COVID and we provided food for 700 seniors, would expenses not covered by the award, example, extra staff and supplies for bagging, be covered?
That's also a very tough question because we have a detailed policy on food distribution under COVID. So it really depends on a lot of different things. So it depends on, the applicant. There's lots of contributing factors to eligibility there. So I'm just going to say, take those questions to your program delivery manager, and based on the specific scenario, he or she will be able to answer that question.
Understood. Thank you so much. I recognize that we are at the top of the hour at 4 p.m., so we will conclude with one last question. Are cultural not-for-profits generally eligible for public assistance now that they are in the process of reopening to the public?
Private nonprofit, if it's a organization that provides an eligible service under public assistance, then yes, they would be eligible to receive funding for those same activities listed in the opening and operating policy.
Okay, thank you for that. Molly, I greatly appreciate the time you've taken to help New York State applicants better understand the recently released policy regarding opening and operations. To all of our applicants on the line, thank you so very much for the time that you've taken. I know everyone has multiple priorities, and that 1 hour and 1 minute is quite a bit of time. For those of you that joined late, we will be posting the slide deck as well as a recording online. And if you have questions, there is also a form online where we will put as many of these Q's and A's as possible. I recognize we were not able to get to everyone's questions. If you do have a point of contact at DISHES because you are already an established applicant, please feel free to discuss with them. Thank you everyone for your time. Have a good afternoon. Goodbye.